Welcome to American Medicine Today. I'm Kimberly Bonati alongside Ethan Youker. Exciting show lined up. Let's get straight to it. Every day, nearly 6,000 women in the U.S. enter menopause, which can trigger symptoms like hot flashes and mood swings. But there are hormone therapy options that can dramatically improve quality of life. Joining us to discuss is Dr. Elizabeth Lowden, Medical Director with Henry Meds and leading telehealth platform. Thank you for joining us, Dr. Lowden.
Thank you so much for having me.
Certainly. So, Dr. Lowden, what exactly is menopause and how does it affect women?
Well, I think this is such an important question, and I'm happy to be here to discuss it with you. So good to have an understanding about what perimenopause and menopause are to start. So women have levels of hormones, and these levels fluctuate on a monthly basis throughout decades of our lives. Estrogen, progesterone, testosterone, it's pretty consistent until it isn't anymore. When women go through menopause, those levels go very low. But what is more difficult to deal with are the symptoms that come when you go through perimenopause. The levels start to fluctuate pretty erratically. You could have high levels of progesterone or estrogen. Those cause all those kind of nasty symptoms that people are used to hearing about. And that's where we consider treatment to help alleviate some of those symptoms.
Weren't there some really nasty side effects of these hormone replacement therapies?
That is
in the
an awesome
past
question, because hormone replacement therapy has been around for a long time. And it was very commonly used for a long period of time also. A lot of women had a lot of alleviation of their symptoms by using these therapies. About 25 years ago, there was a large study that came out called the Women's Health Initiative. And this is the study that caused a lot of fear when it comes to hormone replacement therapy. So there was a little bit of a misunderstanding of the data. Long story short, technology has evolved in the past 25 years. We have more studies. We have a better understanding of both women's bodies, but also the therapies that we have available to us. And we can very safely and effectively treat women with medications and hormone replacement therapy that help alleviate things in the short term, but also provide a lot of long-term benefits.
Are there any risks of blood clots and things like that any longer?
There are always risks when it comes to medical therapy. And certainly you want to have an individualized discussion with your healthcare provider. I know at Henry Meds, we take that very seriously. Everyone is an individual. You need to talk about your own medical history, your own family history, and then decide what the risks and benefits are of whatever therapies you decide on. But some of those things you're asking about, like blood clot risk, cancer risk, those were some of the things that came up in that study, looking at a much older population than what we primarily treat now, with much higher levels of medications than what we use now. So it's almost like comparing apples and oranges. There's always risks associated with therapies now. We just have such a better understanding of what those risks are and can safely and effectively treat people.
I feel so out of my element in this discussion. And actually, I have hot flashes, so maybe I'm going through menopause. But I wanted to back up real quick. What are some of the most common and overlooked symptoms of menopause?
There are so many symptoms you probably wouldn't even think of. Of course, we've all heard of hot flashes, right? Like this is 70 to 80% of women will experience these hot flashes, and that's what you see portrayed in all the media. There's a lot of other symptoms, though, that many people don't commonly associate with hormonal fluctuations. These are things like difficulty sleeping, a mental fogginess, lowered libido, changes in mood swings and energy levels. A lot of women essentially say, gosh, I don't feel like myself anymore, and I don't understand why. Everything is the same. Why do I feel different? And they don't realize that a lot of those symptoms they're experiencing can be attributed to changes in hormone levels.
Is there obviously there's like a relative age where the onset of menopause happens, but I mean, is there like a range?
There is. So the average woman goes through menopause, and menopause is when you haven't had a period for 12 months in a row. They have experienced menopause at the age of 51. But there is a huge range of when these symptoms can start presenting. We most often see them in the late 30s, throughout the 40s, and going into the 50s.
So we really do have a warranty expiration, so to speak, apparently.
We wouldn't look at it like that. Menopause is a normal and natural part of life that women go through. And yes, there are changes in every woman's body that are going to cause changes to how you feel, changes to how you maybe approach life. But I think the point is that we have therapies that can help.
Are there any herbs or vitamins that we should just be routinely taking as women to keep us in the best shape possible and maybe minimize the impact of menopause?
I mean, I always think about things from a hormone perspective. That's what I do as an endocrinologist. I like to think about bone health. We think about menopause and how it impacts bone health and things like calcium and vitamin D. We know that women who lead healthier lifestyles, who exercise, who maintain their mobility, who have lots of high nutrient dense food, do better as they go through different stages in their lives. So while there's no specific vitamin that I could recommend, taking good care of yourself, thinking about your bone health, living a healthy lifestyle is only going to be beneficial.
Now, when you mention things like calcium, I've heard in the past that typical calcium supplements can build up and cause kidney issues. And I have also heard that if you take supplements like a coral calcium, it's better metabolized by the body and helps you kind of stay off things like osteoporosis.
So women need calcium. So we need, on average, if you're a postmenopausal woman, someone who's gone through menopause, you need 1,200 milligrams every day. We know that we absorb the best through diet. Sometimes, though, when people don't get enough through the diet, they're at risk of having lower bone health and fractures. And that's when we go to things like supplements. There's a number of supplements out there that can be beneficial. And I think the best thing is always to discuss it with your healthcare provider, because they can really sit down and say, these are your medical issues. These are your risks, including things like kidney disease. And this is what I would recommend. Real
quick, just back to the hormone therapy, and we're almost out of time, by the way. So, who's a good candidate for it, and what are some of the treatment options that exist?
So, lots of women are candidates. I would say probably the vast majority of women can have some sort of symptom relief with the variety of options we have. So, there are pills, there are patches, there are creams, sometimes there are injections. It's a very individualized treatment. And so providers primarily look at what sort of symptoms a patient is having, look at their medical history, and then come up with a mix of all of those things to create the perfect little mix just for that patient. And so if you ever go somewhere and they're like, these are your options and these are the only options, that's probably the wrong place. You want to go someplace, like what we do at Henry, where we sit down and talk through, what are your symptoms? What's your medical history? These are our 3 options. What's going to work best for your lifestyle? But there's a lot of options out there.
That's great advice. Everyone should be their own best advocate. Thank you so much for being on the program, Dr. Elizabeth Lowden, Medical Director with Henry Meds and leading telehealth platform. Thank you for being on the show.
Thanks, Doctor.
It's a pleasure.
Well, that's all the time we had for this segment. Make sure you stay tuned. We'll have more after the break. You are watching American Medicine Today. Andrew is a hardworking family man from Alabama and likes spending time in the great outdoors.
Working mainly maintenance and refrigeration work all of my life. Hobbies, I enjoy fishing, being out on the water, riding boats, motorcycles, spending some time with the family. I fell out of a tree doing some tree trimming work at my own house. Got my left knee caught in the fork of a tree and tweaked my hips and back up pretty bad. Had went through the pain for a little better part of 12 years, doing physical therapy, chiropractic care, medications, injections, and everything but a back surgery because I was terrified to have a back fusion done. It was very sharp stabbing pain, numbing down my legs, mainly my right leg, my left leg some, not as much depending on how long I stood up and worked at a time. But my right leg would go numb pretty much all the way down from my hip all the way to the top of my foot.
He tried conservative treatments, but none of them provided the lasting relief he was looking for.
Chiropractic care and physical therapy helped for a long while. Probably a better part of 9 years. I'd done those for a long time. Was doing chiropractic care 3 to 4 times a week. And then I would do physical therapy at least once or twice a week. And then some weeks I would do massage therapy instead of physical therapy to ease up the muscles. It just got to where nothing really helped. I would go to a chiropractor and get an adjustment. And then 30, 40 minutes down the road, it would go back to hurting again. We went to the spine center in Huntsville and discussed options with those. And their only option was a back fusion to cut you open and put in metal rods and metal parts, and that wasn't an option for me at the age of 40.
He did online research to find alternative facilities that could help him. When he found the Bonati Spine Institute, he read reviews, watched patient testimonials, and spoke to other patients who had already received the exclusive Bonati Spine Procedures.
The Bonati system had the best success rating of all.
Feeling good about the prospect of relief, Andrew traveled to Hudson, Florida for an in-person evaluation. Upon arrival, he was provided with a thorough physical exam and updated MRIs and X-rays at the on-campus imaging center.
Went through MRI, X-ray, met the surgeon, and some of the OR team was back there when I walked through, checked everything out. You had to have several X-rays, some blood work done. It's an active day, but it's worth the time. The initial consultation was, with the pain situation, we just had general conversation, and he could about tell where my pain was coming from by looking at the MRIs and the X-rays. And we, both went over the locations of the areas that was the most severe and where the pain ran down my legs. And the surgeon went over my MRIs and X-rays with me very detailed, so we didn't have no, missed opportunities.
The patented Bonati Spine Procedures utilize conscious IV sedation. This keeps the patient comfortable, but also awake and communicating with the surgeon to pinpoint the source of their pain and eliminate it before the patient leaves the operating table.
The pain relief was instant. It was instantaneous. I was like, I can feel it's not there no more. At first I thought, hey, is this the medicine? And I asked, and the doctor's like, no, it's the relief of what we have done, the procedure. In years, I hadn't slept longer than 2 or 3 hours. And the first night of my first procedure, I slept in bed for 5 or 6 hours.
Andrew highly recommends the Bonati Spine Institute to anyone suffering with neck or back pain.
It's life-changing in a good way, because for most people that's dealing with back pain, is they understand that that's a pain that nobody's hardly ever went through. It's something very hard to deal with. Knowing the relief I could have had years ago, if I would have done this then versus now, I would suggest somebody do it. The earlier the better. There ain't no sense in waiting.
Now pain-free, Andrew is looking forward to spending time enjoying his favorite outdoor activities alongside his family and friends.
Looking forward to spending a little downtime with the family for a while. Looking forward to getting back out on the water this summer and playing on the boats and riding motorcycles and enjoying life again. There's a better world, because, it's the pain-free world is going to be enjoyable. And I hadn't been there in a long time.
To see more stories of recovery just like this, search for the Bonati Spine Institute on YouTube, Rumble, Apple's App Store, Google's Play Store, Roku, and Amazon's Fire TV. Welcome back to American Medicine Today. I'm Kimberly Bonati alongside Ethan Youker. A new book details what happens when our military trains soldiers for battle, but doesn't do much to help them when they return home. Joining us to discuss is Tyler Gray, former Delta Force operator and author of Forged in Chaos, A Warrior's Origin Story. Thank you for joining us, Tyler.
Thank you so much for having me.
And thank you for your service. Now, can you tell us about the years of training that you went through to become a Delta Force warrior?
It's a long process. I think by that time I'd been in the military, almost 5 years. So it's like any process in the military, any special operations unit. It's done in segments. You do different training spurts depending on kind of your career path, and then the kind of final training is about a year straight. And so it's a very long, methodical process, and it's definitely very designed to get you to a certain end state.
Well, let's get into your story. Tell us about what happened that fateful night in Baghdad.
So we had been going after the Iraqi insurgency was very prolific, I guess, at the time. We were going after the leader actually of the entire insurgency that we had been going after for a while at that point. And it was during a nighttime raid in Sadr City, which is a neighborhood in Baghdad. And, it was just one of those times, I'm going to say missions, but this happens to everyone, where a bunch of little things just kind of were different than they normally were. I was blown up inside the house during the raid, and it ultimately got me medically retired out of the military, as well as obviously changed my life forever, as far as the not just the physical aspects, but the mental aspects as well.
Was this like a grenade, or?
It was an explosion inside the house. So it was a very large explosion inside the house. And wow. A lot of trauma in my mind is based off of what the expectation is. If you go in with an expectation of, rainbows and lollipops, it's going to be one thing. And if you go in with the expectation of, violence, your brain reacts to its expectations. So as, bad as it was, I wasn't, it was very much in my realm of expectation, or at least not expectation, but possibility.
Can you walk us through what it was like through the physical recovery and then the challenges you had with the mental wounds taking over?
Yeah, the physical, challenges, and I'll just start with this one. Not that it's super relevant, but it is in a way. You watch movies and the guy gets blown up, and then the scene cuts and it opens with him in the hospital, and his wife is there or whatever. And the reality is, it took me a week from the moment of the injury happening before I was back in the United States. And traveling overseas sucks. It sucks a lot worse when you're catastrophically wounded. So that was just one example of, the physical journey on the road to healing was ultimately about a 4-year process. I spent obviously a while in the hospital. I got out of the hospital, and then I was back and forth, surgeries, and then healing and rehab, and then just prepping for another surgery. And that went on for a while. Because that went on for a while, it really, for lack of a better term, the best way I can say it is I couldn't be myself. All the things that I did that were intrinsic to who I was, I could no longer do. I couldn't be me, for lack of a better term. And you don't realize how much, when you identify yourself with what you do, when you can no longer do that, who are you? And that was the start of really the mental, split happening, for lack of a better term.
We're going to take a quick break. We'll be right back with Tyler Gray after this. You are watching American Medicine Today. Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati Spine Procedures. Using his genius, Bonati invented the precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati Spine Procedures, they consistently reflect 98.75% patient satisfaction. 80,000 procedures have been performed exclusively at our location. Nearly half our patients have suffered from failed back and neck surgeries at other facilities. Bonati succeeds where others fail. Welcome back to American Medicine Today. We're continuing our discussion with Tyler Gray.
I pulled a couple of terms from your book, Forged in Chaos. One of them, which is shifting to the green zone. What exactly does that mean?
Well, it's not talking about the green zone in Baghdad, although that could be confusing. No, the green zone. So PTSD, it's a nervous system dysregulation. Okay. So the nervous system is normally not in fight or flight. And then when an event happens, a traumatic event, you get thrown into an ANS response, fight, flight, freeze. Traditional PTSD is then later, when that life threat is no longer there, your body still is thrown into that ANS, autonomic nervous system response, when it shouldn't be. The green zone would be the nervous system's state of calm. That would be the nervous system not being in an ANS response, and basically just, the nervous system looking at things as calm and safe. Safe really being the key word.
And what about the next quote, which is identifying the destroyer? Can you explain?
Yeah, so that one's a little bit more complex to explain. I'll try and do it the fastest way I can. I believe, I had certain qualities that I called the warrior, and the way I define a warrior is not by wearing a uniform or not. It's not by a job. A warrior to me is defined by a person who, when pushed, pushes back, or when pushed down, gets up. What eventually happens, I believe, is when that's not working for you, when the innate, authentic you is really not helping to survive the environment, and I think a lot of us create what I call the destroyer. And the destroyer is the you that you create. It's the character that you create that is tougher than the real you at that time. And it's this mask you put on to try and get you through difficult times. The problem is when the environment is consistently bad and you consistently need the destroyer, what can happen is the mask that you're wearing, you wear it for so long that you forget it's a mask. And so at some point, you have to reconcile those two, the real you and the character that you created to survive, and really get over, you have to come to terms with who you really are. And when I got blown up, really that character could no longer exist because I wasn't able to be that character. And so that led to a massive identity crisis of really not knowing who I was anymore, because I'd been living a fake character for so long.
That is crazy. I can only imagine the extra weight on top of everything else as you go through that, trying to make your way back to yourself.
To the point that you just said, I say it this way. The way the mental health community or really the medical community looks at things, they go, oh, you have PTSD. PTSD is 4 letters. And the problem with that is it's not just PTSD. And the more people tell you it's this, the more we're ignoring that it's a much more complex problem. Identity, loss of purpose, loss of all these different things. But if you talk to any veteran, they'll go, oh yeah, I had that. Those have nothing to do with PTSD. So it's not that you have one problem, it's that you have 10, and the 10 come together in a way that makes it seem like it's this bottomless pit. It makes it almost seem unsolvable, because you don't, like any great problem, the problem is you don't know where to begin because the problem's so big. So for me, what helped me dramatically, and what the book is really about, is I go, okay, that may be a part of the problem, but it's also this, and this. And these are this is ways that you could start working on those other different problems. And once those start to get better, you suddenly develop this feeling like it's no longer this insurmountable task, or this mountain that you cannot reach the peak to.
Thank you so much, Tyler Gray, for being on the show and sharing your insight as having lived through this. Former Delta Force operator and author of Forged in Chaos, A Warrior's Origin Story. Thank you for being on the show.
Thanks, Tyler.
Thank you very much.
Take great care. Well, that's all the time we have for this episode of American Medicine Today. If you would like to see previous episodes of our program, download American Medicine Today to your favorite streaming devices. If you have any comments or questions, contact us at the numbers below. Or you can tweet at Dr. Bonati using the hashtag American Medicine Today or hashtag AMT. We would like to hear from you.